Hello, I am Dr. Jyothirmayi, consultant psychiatrist at Continental Hospitals. Today, let us throw some light into what is autism. Autism and why is it important for us to know about autism? Autism is the world's third leading disability in the world, and let us know about what are the symptoms of autism, how we can identify autism. Autism is a neurodevelopmental disability. So, it is a neurodevelopmental disorder which starts from the time of birth, but which becomes evident as years pass by, around 1.5 to 2 years of age. The most common deficits that we see in a child with autism are problems with social interaction, problems with communication and stereotype behaviors. Problems with social interaction, how we can identify them? The infant would be lacking a social smile when the mother or a caregiver tries to play with the child. Usually we see that the child will smile back. So, this social smile would be lacking. We also would notice that there would be lack of eye contact. They would not see the adult through the eye. So, the eye contact would be lacking. And we also see that we usually, for normal children, we see that they get very anxious when they are with strangers. But with a child with autism, they lack this trait. So, sometimes they are quite comfortable even with strangers. So, the stranger anxiety could be lacking. And also we can find that they would be mostly playing alone. They have difficulty in developing friendships. Say they would mostly prefer playing alone as a toddler, and also when they are admitted into school in the pre-primary also, we can see that in the class that they are the ones that who are always preferring to play alone. That is how we can identify them. How can parents, schools and societies come up with helping these children with autism? What can they do? I had a parent who was quite depressed with a child with autism. So, because of his depression, he could not focus on the child. So, the child was not able to get proper therapies at proper time. So, it becomes important for the parent as an individual to seek therapy for himself or herself if they are undergoing any stress or any depressive symptoms, so that if they are psychologically well, then they would be able to aid the child also properly. And then parental training is also one of the core therapies, where the therapist would help the parent. They would teach parents some of the things that would support the child. How come in schools they can aid? See, schools are sometimes when early intervention is not done and the child is admitted in the school, that is in pre-primaries, and the child is aloof, the child is not able to speak properly, it becomes very essential for the teachers to understand and know that such and such condition like autism exists, and they should know the symptoms of it so that they can identify in the child. And every school, if they have a school counselor or a psychologist who is well trained in doing a regular checkup of all the kids for certain psychological disorders, which includes autism also, that would also help in early identification. Let us see how we can approach a child with autism, how we can manage the autism, and also the family of the child, the family living with the child, that is the parents and the child together. Early identification is the key here. So, mostly what happens in Indian parents is there is lack of awareness of this thing called autism. So, if there is a speech delay, they tend to take the child little bit later. So, the key here is early identification, which can be done by the pediatrician also, and the parents, if they know about it, they can take for professional help. So, we call something here called early intervention therapy, where speech and language therapy, there is a speech therapist who can aid the child in developing the speech. And then we also have in early interventional therapy something called nutritional therapy and physical therapy. So, in nutritional therapy, see, sometimes a child with autism does not like a few textures. So, they might not want to eat particular foods. So, likewise they can develop some deficiencies. So, the nutritional therapist can aid in how the parent can help the child to have proper nutrition. Physical therapy, so the physical therapist will aid in particular movements, whole body movements or fine movements to reduce some of the stereotype behaviors that the child has.